I'm Dr. David Sedgey at Momentum Chiropractic in San Luis Obispo, and today we're going to talk about pinched nerves. Now, pinched nerves is a big topic. If you're feeling some sort of pain, it might be because of a pinched nerve. But overall, nerves, where can they get pinched? What's it coming from? So a nerve starts in the brain, goes all the way, let's say to my index finger, my pointer finger, and it's making this finger able to move. So a wire has to run from this finger all the way through my arm, through my neck, and back to my brain. And during that entire traveling period, it can get pinched in multiple spots. From the finger all the way up to the shoulder, we call that a peripheral nerve pinch. Whereas at the spine, that can be a central nerve pinch, okay? And there are several things that can pinch a nerve. We'll focus in today on the spine. Now, the spine has all these wires that make everything in your body work, we call them nerves, and they run out through these little holes in between the spine bones. We call that a foramina, or a nerve opening. Now, the bone can actually shift backwards towards the nerve, or we can get a bone spur or arthritis that can pinch the nerve directly. Or the disc can start to bulge backwards right at the nerve, and that can pinch the nerve. And your nerves don't just control pain. Pain is only 10% of what a nerve does. The other 90% of what a nerve does is make your entire body work. For instance, the nerve that controls my finger. That's how it's able to move, is because of a nerve telling it what to do from my brain. But on top of that, let's talk about an organ like your heart. Your heart has to go up and down, and it has to beat, and that's controlled by the brain too, by nerves. And if any of those nerves are getting choked or pinched, think about it in terms of electricity. How much electricity and power do you want powering your heart? All of it, 100%. We want as much nerve flow going to every part of our body possible so that it works as beautifully and works as well as possible. So if a nerve is getting pinched, that is a big deal. Not just because of the potential of pain, but the functioning of your body, how it works, and whether that will cause future problems. The most common area to get choked is at the spine, especially around the bones and the discs. We have to make sure that the bones are aligned, that the disc isn't bulging out, get everything away from the nerve so we can get 100% nerve flow going to every part of your body, making it work as wonderfully as possible so that you feel and function at your very best.